So we have a female patient. Her diagnosis is a right parietal hemorrhagic stroke. Also in her medical history, she does have RA in her right shoulder and both hands, and she also has type 1 diabetes. Her support system right now, she does live alone. However, she does have two children and a supportive family and friends that are willing to help her. She is currently a retired, someone retired from the police department, and she does have an active lifestyle currently. She likes to garden and stuff of that sort. Moving right along to kind of what the stroke did. She does have left side neglect. With that, she also has decreased sensation in her left extremities, and she does have spastic tone currently in both left extremities. Moving on to her functional mobility, she can roll to both sides with supervision. Supine to sit and sit to supine is min assist. Her static balance while sitting is independent up to 5 minutes. And then once she is standing, she can stand up to 1 minute at this moment with right upper extremity support. With weight shifting, her weight shift to the right is about decreased to about 50% currently, and then to the left it's really low and she kind of loses balance once she shifts to the left. Some other things with her with the left side neglect, in the eval, the therapist did say that once he moved to the left side of her vision, she did not know where he was or acknowledge that there was a therapist present. So we'll go into the limitation. I chose ambulation as her limitation, her activity limitation. I chose this because she's already standing. I know she has decreased support of standing right now, but I think from the intervention we can start and then start progressing her so that she can be able to ambulate, so that she can have increased independence. Since she is living alone, she'll be able to walk, to feed, to do everything that she needs, ADL style. So the two impairments that I chose, the first one was the paresis in the left lower extremity. I chose this just because with the decreased sensation and then the overall weakness, that's something that we really need to focus on if we're going to get her up and ambulating. And then the second thing that I chose was the left side neglect. I chose this for obvious reasons. If she cannot see from midline to the left side of her body, it's going to clearly set her up for running into things, maybe injuring herself even more. And then just overall, just the safety aspect of only having half of your vision, or only responding to half of your vision. So with these interventions, the first intervention took care of the paresis, and I pretty much got her to standing. She put the right upper extremity on the parallel bars, and I moved her left arm from that spastic flexion to having, her elbow extended, her arm or her wrist extended, her fingers extended, and her wrist in pronation. And then I placed it on to the onto the parallel bar. I did that just to inhibit that spastic reaction, and to just kind of work on stretching that while we actually worked on weight shifting. I did help her with shifting the weight. We just shift to like the right and held for 5 seconds, and then shift to the left and held for 5 seconds. I also blocked her knee on her left lower extremity, just to make sure that it didn't buckle and to keep her safe. And I did that, like I said, just as a pre-gate, so that we can then progress on, since you need to be able to shift your weight in order to ambulate. The second intervention took care of the left side neglect. With that one, I just sat her at a table. I once again took her arm out of that spastic flexion position and laid it on a washcloth. And then I had her right upper extremity go on top of her left upper extremity to hold it there to get that nice stretch while we did the activity. During the activity, I simply placed colored post-it notes at different angles on her left side. The first one only being slightly off of midline, all the way to about 70 or 80 degrees to the left. I then called out the colors so that she had to scan with her head to locate the color, and then to move her left and right upper extremity to that set color. And I did this for many reasons. I wanted her to be able to scan to locate the color, and then on top of that, I also wanted her to get the proprioception feedback of moving her left upper extremity to that set color to help her with everything. So that is all, and have a good day.